Well, first of all, before I begin, Jean just wants a quick announcement and then we'll begin.
Well, first of all, I want to thank Sally
Oh,
for setting this up. She worked really, really hard to do this.
no, Mark and I,
Yes, so,
well, I couldn't have done it without Mark, so I want you to know that.
hey, Mark. Yes.
And I'll,
We're closer to the stand so the people, because that microphone is the way the people on Zoom hear you.
This is new for me.
no,
You don't have to.
this isn't a mouse.
I'm just here to actually do a follow-up and to let you know how we organize this. We're all on a care committee. And we're organizing some subgroups according to interest. And and Sally and I are working on the one for hearing. And so I have a little clipboard, and after our presentation today, if you'd like to be invited to come for a smaller group where you can ask questions and explore, where did you get your hearing aids? How do they work? How do you give them, how do you maintain them? Who told you you needed them? And is that why you're here? So if you want a follow-up group or session, just sign your name up and we'll put one together. And we're all here for a reason, and we're all here to help each other. So thank you.
Thank you. Okay, well, recent events back in the day when we used to sit in big groups, and more often we were saying, I can't hear her. What did he say? And, it becomes that game where what's that game called?
Telephone.
Oh, yeah. So we're playing telephone when we go out to our happy hours. And so we decided that it might be time to get some advice for those of us who need it. And Anne actually suggested that I call the Cheers Ear Clinic. I called them, and right away, Dr. Nick Falacci volunteered, and it was very kind. We've been back and forth for months, and he's been very kind and generous with his time. So Dr. Falacci is an expert in audiology and hearing, and he works with his parents at his clinic, and he has volunteered to talk to us and help us with our advice, with any needs that we might have. And I gave him a list of things that he might talk about. So I want to introduce Dr. Falacci. Thank you for sharing your knowledge with us. And you seem like a really nice guy. We were all just talking about it.
Thank you. Well, yes. So before we get started, I just want to let you know that we did give you guys some handouts, and if anyone on Zoom wanted one of these, let us know, and we can get your contact information. We can mail stuff. Joy's our marketing director. She's with us, and so she really helps out with any of that. So if you're at home and you don't have any of the handouts and you want one, just let us know and we can figure out a way to get them to you. So we're going to talk a little bit about hearing today and audiology and all things ears. The way that I like to describe it as far as audiology goes, because a lot of people think that we do everything from ear surgeries and infections and things like that. I consider it as we're really the doctors of hearing, whereas an ear, nose, and throat doctor is the doctor of the ear. So they're the medical side of our profession. So it's kind of like optometry and ophthalmology. Ophthalmology does the surgeries and eye infections, where optometry just does the vision side of it. So moving on, let me just talk about this. So we call this Ask an Audiologist because I also like to engage with you. So if you have questions, I have a slide at the end for questions, but I'm okay with if you have something along the way, you can stop me and I'll answer any questions. So if you want to get involved, I'm happy to answer questions throughout the way. I do work in a clinic with the other two Dr. Falacci's as well. My father's our director, that's Robert, and then my mother actually just joined our practice back in December. She was a pediatric audiologist at Children's Hospital for 34 years, and then once our audiologist left Cheers, my mother decided to leave Rady and come and do our pediatrics. So now all three of us work together. So it's really fun. And we're located in Mission Valley off Camino del Rio North in a building we share a building with the Senta Clinic doctors who are ear, nose, and throat specialists. And there's also a neurologist that works with us who works with balance and dizziness and vertigo disorders. I don't have a lot of balance or vertigo in the presentation today, but it is pretty closely related to the ear system and various other body systems as well. But it is definitely kind of in conjunction with the ears and hearing. All right, so who is an audiologist? I love this question because most people don't know who an audiologist is until you need one. So when people ask me what I do, I tell them and they say they don't know what that is, or they'll give me the what, and I don't know if they're joking about not hearing or if they really don't know. We specialize in the diagnosis and non-medical treatment of hearing loss. So hearing and balance testing is within our scope. Like I said, we have a neurologist that specializes in the balance side. So at Cheers, we don't really do the balance testing, but other audiologists in the community might be doing that kind of testing as well. We work with hearing aids, cochlear implants, and also bone conduction devices, which are devices that would be attached to the head and send the signal via vibrations in the skull and the bone. So certain medical types of hearing losses might require that kind of a hearing aid. All right, so ear, nose, and throat specialists. So like I was saying, these are the medical doctors. They specialize in the medical treatment of hearing loss and disorders of the head and neck. So deviated septums, sinus, anything related to the throat, and ear surgery. So they do surgery, they prescribe medications to treat infections or any viruses, things like that. And they also will refer to other specialists. Like I said, neurology is another closely related field to us as well. So another provider that you might come in contact with in the hearing world are the dispensers or hearing instrument specialists. These providers, they are licensed by the state of California to work with hearing aids. All they would really need is a high school education. No advanced degree is required for a hearing instrument specialist. They cannot perform hearing testing for diagnostic purposes. So if an ear, nose, and throat doctor needs a hearing test, a hearing instrument specialist cannot perform that hearing testing. They can really only do it for the programming of hearing aids. So if they see a hearing test or they see someone for a hearing test and it comes out that there's some kind of possible medical involvement, they would refer it to an ear, nose, and throat doctor who would then probably get a hearing test done by an audiologist. So there's varying levels of education differences between an audiologist and a hearing instrument specialist, but they're licensed to sell hearing aids in California as well. All right, so services at Cheers. So we do comprehensive audiometric diagnostic testing. So these are our hearing tests. And that's just could be for if you came in and said, I'm having trouble hearing, or it could be if you were referred to us by a physician or a ear, nose, and throat doctor. We do hearing aid fitting, orientation, and follow-up. So that would be initial programming, teaching you how to put the hearing aids in, take them out, clean them, charge them, everything you need to know about the hearing aids, and then any follow-ups if something's not working right or if you have any concerns that you need to address, you can always, come on in and we can help you out with those as well. Hearing aid verification testing. So this is a testing that we do that verifies that the hearing aid is meeting your prescription. So some people will say prescription. That's very different in my mind. When I'm looking at a prescription, I'm thinking, medications or things like that. But just like our eyes, there's a prescriptive need for a lens. We have a prescription in audiology that by the research shows us that the hearing aid is giving you enough amplification at each of the different pitches to help you understand speech the best that you can. And so this is the gold standard for hearing aid fitting. So if someone's not doing this kind of a testing, I would probably seek somewhere that does. And because ultimately this is what one of the big things that separates a over-the-counter hearing aid or over-the-counter device from something that is dispensed by a provider like us. So this kind of a testing is really what's going to show us that your needs are being met by the device that that you've got from our clinic or from somewhere else. We do tinnitus evaluations and treatment. So tinnitus, I have some slides on tinnitus later on, but tinnitus is a sound or oftentimes ringing that is perceived in the head without hearing aids. With hearing aids, it's a sound, and oftentimes tinnitus is a symptom of hearing loss. I do have patients though with normal hearing that also hear this ringing sound in their ears. But a lot of that it's not really something we can eliminate or get rid of, but it is something that we can help treat. And the reason I emphasize this is because there are a lot of providers that don't understand that. So primary care doctors, they might tell you, well, it's just something you have to get used to. There's nothing we can do about it. I hear that all the time, and it breaks my heart because people who struggle with tinnitus really struggle, and to hear that is almost ripping hope away. And I don't want that to ever be the case, because there's oftentimes things that we can do to help with managing that tinnitus better. And then we do bone conduction hearing devices, which I touched on. So it would be a device that picks up sound from the outside, sends it via vibrations in the bone, and can kind of bypass, I don't know, if there's fluid behind the middle ear behind the eardrum that can't be resolved, or some kind of condition in the ear canal that doesn't allow sound to pass through effectively, we can kind of bypass that with a bone conduction hearing aid. So those are usually a device that we work in conjunction with the ear, nose, and throat doctors, because they would be the ones doing the surgery and implanting it, but we do the programming on the device. And then pediatric audiology services as well. Like I talked about, my mom is the pediatric audiologist at Cheers too. We used to do cochlear implants. However, we don't do them anymore, but there are audiologists that we can refer to that do programming on the cochlear implants. So similar to the bone conduction devices, an ear, nose, and throat doctor would be the one that is the surgeon, but the audiologist is the one that actually does the programming to help make sure that the device is working properly to help you hear the best that you can. Okay. Yes, question.
Why is it that there's not many men here? Men are usually the ones that don't hear their wives, right?
It might have to do with the proactive nature of the females of seeking help for possible disabilities and possible different kinds of needs. I see that a lot. Audiology in general there's a majority females, I'd say, as well as the providers.
Maybe that's because they live a little longer.
I wish I had a better answer for you, but I'd love to see more men seeking treatment for hearing needs. But, you know, the hard part about this is admitting that I'm having trouble. And when you admit that you have a need for help, then, you know, there might be some pride involved. It might be a cosmetic thing. I think for a long time there was a stigma behind hearing aids where people didn't want to wear them because they didn't want to feel old. And you know, it's funny because in my line of work, I have a whole new perspective on what old is. the number does not mean anything to me. I have a patient who is 104, comes in unassisted, walking on her own, and sharp as a tack. To me, that's not old. I also have people who are much younger who have, are moving a lot slower. And so age, that number doesn't mean as much to me anymore. And ultimately, hearing aids will ideally help you feel younger and be more involved and be more, active in the conversation. And so we want to provide a better quality of life and not have you have to work so hard and struggle through those types of environments. And we'll talk a little more about that. But as far as the male presence here, I'd like to see more someday. I appreciate you for being here.
You're not here for yourself, are you?
So we're going to get into the over-the-counter hearing aids. So in September of 2017, the U.S. federal government passed legislation requiring the Food and Drug Administration to regulate the sale of over-the-counter hearing aids. This was finalized and implemented in August of 2022. So this allows consumers to purchase hearing aids without having to go through a clinical provider. So before I start talking more about this, I just want to know, do any of you have any thoughts on this? Is this a good thing? Is this a bad thing?
I'm thinking that, hearing aids are really expensive. And well, to some degree lately, insurance companies are putting some of that bill. But up to this point, they haven't really done that. So I have a friend who has an over-the-counter, has had that for years and years and years. And I'm thinking she probably didn't have a real heavy dose of hearing loss to begin with, because I don't know, but I'm thinking that over-the-counter is an amplification of sound like a microphone and doesn't attest to anything that you're losing decibels. My husband used to go out with a chainsaw and he would cut down trees at Christmas time for his friends in the Christmas tree lots. Well, his decibel range that he lost really was something they couldn't fix, but they did the best that they could.
Right.
But I think that maybe people will go to this since it's now legal to do over the counter. I mean, even Apple has their hearing buds now that have a component of hearing aid. I don't know what that means exactly.
Right.
But I think that people are probably going to be pretty unhappy about that if they have decibels that aren't going to help if you just get amplified sound. I don't know. Is that what it over the counter does?
Yeah, I think you have a fairly good grip on this. So generally, a lot of the over-the-counter hearing aids are for a mild to moderate hearing loss. So if your hearing loss is any more severe than that, a lot of the times it's not going to be able to meet the needs of that more severe degree of hearing loss. So that's part of it. One more thing that you touched on was the accessibility and the pricing. So that's a positive, is that it is a cheaper option to get you some help. So that's a good thing too. So that it kind of increases the accessibility to hearing aids. One thing that people don't recognize is that with an over-the-counter hearing aid, you do not have a provider.
Yeah.
So if something happens and it's not working right, where are you going to go? Who's going to help you? Or does that go into a drawer? So that's part of it. One thing I talked about earlier was the prescription. So it's not programmed specifically to a prescription. They do have some rudimentary ways of doing some hearing testing to kind of get an idea of what your hearing loss is. So that's a little bit more advanced than, say, the traditional amplifiers they used to have. So that's why they can call them hearing aids now. But but it's just not quite as precise. And then you don't have the person there to help you. So, but I mean, you're pretty spot on there. Sally.
I've been told, that I can't, I just found out I cannot wear microphone hearing aids. Would that be better than nothing?
Depending on what your hearing loss is, so it's hard for me to say without really seeing what a hearing test looks like. But most likely having something rather than nothing at all is probably a better idea. Generally speaking. Yeah.
It seems as though this whole concept you're talking about is akin to readers, over-the-counter readers versus prescription eyeglasses or prescription corrective lenses.
Right. It can get
Right.
you some improvement.
But in that world, nobody thinks that they're solving the problem 100% by going and getting a pair of 2.0 readers, right? Or 200 readers. They know the difference between in the hearing world. Does the consumer understand the difference between these over-the-counter hearing aids and
That's
the
what I
equivalent
hope.
of corrective lenses?
I'd hope so. And the hard part about it is that the terminology behind a reader versus a prescription lens is those terms are different. But an over-the-counter hearing aid is also still called a hearing aid. So there's not as much of a distinction in the terminology between the two. So this is something I wanted to talk about because I want to help educate people to let them know that there is a difference. Yes. Oh, get her the mic.
So, yeah, so I'm not sure if I have a whole lot of hearing loss. I'm not having difficulty understanding anybody in this room, but my husband has over-the-counter hearing aids, and his experience so far has been that there's both a tremendous range of price and a tremendous range of quality in over-the-counter hearing aids. So
Yeah.
just as there's a difference between prescription and over-the-counter, within over-the-counter, there's a huge range.
Yes. And I do have some slides that will touch on the differences in pricing as well. So we'll get to that too and hopefully answer some questions. If you have more after that, let me know.
And it may be something for later and you
Okay.
can say, hold up. So is there some distinction between hearing and understanding mumbling?
I love that question.
Because that's, you watch TV and they just mumble.
Yeah, definitely.
Is that a later thing?
No, I can touch on that now.
Good.
I don't think I have that in here. I don't think. So it depends on what the hearing loss looks like because our speech has different frequencies for different speech sounds. So, for example, an S sound, S, F, T, Sh. Those are high frequency consonant sounds versus a vowel. Ah, oo, E. Those vowels are lower in pitch and hold more volume. So when someone has a hearing loss in the higher frequencies or the high pitch sounds, the speech clarity is what's affected. So it's oftentimes, I heard you, you were talking, but I didn't understand what you said. So, and if you have a hearing loss in both, then all of everything sounds softer and you're not understanding. So it just depends on what the hearing loss looks like that would result in specific types of hearing concerns, like you mentioned. So when we do a hearing test, we look at that first and we say, okay, now what are your hearing needs or your difficulties? And then we compare it. Does this make sense with the hearing test? Well, if the answer is yes, then hopefully we can get hearing aids and correct for that. And so someone who just has difficulties with those high frequencies, when they get hearing aids, it's not this big booming volume effect because we don't need to amplify the low pitches because they have good hearing there. it's really giving them a boost in the highs, and it sharpens up the sound to give better clarity. So there is a distinction between those two.
Shows up through the testing and high frequency, low frequency,
Mhm.
all of that would provide answers when someone comes in and says, I hear the sound, I
Mhm.
just talk slower or whatever.
Absolutely,
Okay.
yeah. Our testing will lead us to figure out how to best resolve those kinds of concerns. Yep. All right. One last thing here is my hope when this came out, this over-the-counter bill came out, my hope was that it would provide better accessibility to people and hopefully would be a good stepping stone for someone to say, let's try this out. Wow, that helped a little bit, but I wonder if I could be doing better. And then that would be the step into getting into a prescriptive type of device. My fear behind it was that someone would get these over-the-counter hearing aids, not enjoy their experience, and then say, I tried hearing aids, it didn't work for me. So that ultimately is kind of the word that I want to get out, is that if you've tried over-the-counter hearing aids, it didn't work for you, that doesn't mean that hearing aids in general do not work for you, okay?
Nick, what was the objective of the lawmakers? What was the objective of the bill? Make them more affordable, make them more accessible? What was the thinking process?
Both. All of the above. We in audiology, we're small. You ask an audiologist in San Diego if they know another audiologist in San Diego, they most likely will know that person. So the amount of, and I think my graduating cohort when I was in grad school was, I think, 8 people. And I think we started with 11. So it's a small class. So there's not a whole lot of us. And for us to be seeing all of the people with hearing loss is hard to do. And so the accessibility was a big part of this, I think. And then the cost as well. So, for some people with milder hearing losses that, might not be able to afford a prescriptive hearing aid, they have something for them. And then, like I said, it's better than having nothing at all. And so ultimately it's exactly that. All right, I'm going to get into some frequently asked questions. Why do people with hearing loss need to wear hearing aids? How much do hearing aids cost? Will I hear perfectly with hearing aids? Do I have to wear my hearing aids all the time? I get that one all the time. What is the difference between Cheers and Costco? All the time, all the time. All right, so we'll start off with the first one here. Why do people with hearing loss need to wear hearing aids? So the most obvious, why did you go see an audiologist? Well, I'm having trouble understanding my friends and my family. My conversations, I'm missing it. I'm asking, what, huh? He repeat that. He talk slower. Or I just nod and smile. So the communication part, that's pretty obvious, but our hearing does so much more than help us communicate. Our hearing also keeps us in touch with our surroundings. So an example I like to give is I had a patient that worked at a desk job, and anytime someone approached her from behind, she would startle. She did not hear footsteps or clothes rustling of someone walking up behind her, and before she knew it, someone's tapping her on the shoulder and she didn't know they were there. Or say you're in the back room of your home and the front door opens. No one said anything, but your brain would say to you, someone's coming into the house or leaving, hopefully expectedly. So safety, I guess, would be another reason. They've got the electric cars on the road that you can barely hear, and you're, walking out of your car in a parking lot to go to the store, and you don't hear the car pulling up. You don't hear the road, the tires on the road. They don't have the loud engines anymore. So keeping in touch with your surroundings is important. And even just pleasurable sounds, the birds chirping. You know, there's sounds that with hearing loss over time, your brain gets used to the hearing loss and considers that the normal way to hear. And then before you know it, you're missing out on sounds that you used to hear and you just don't hear them anymore. And then the last thing is reduced risk of cognitive decline. So within the past 10 years, there has been a lot of research that's come out, and it shows that there's higher risk of cognitive decline with untreated hearing loss. So, and then also the more hearing loss you have, the higher that risk gets. So hearing aids can help keep the brain stimulated with sound and keep those neural connections from the ear to the brain strong. And so that can help reduce some risk of cognitive decline too. So the communication, environmental awareness, and our cognitive health, those are the big reasons that we feel it's important to treat hearing loss. Okay, so the effects of untreated hearing loss here, dementia, depression. I mean, you can think that I used to be involved in all of these things that I loved, and now I don't enjoy them as much anymore. I don't want to go to that party. I don't want to go out to the restaurant. I don't want to go to the movies. I don't want to do these things that I used to love doing because I struggle, and now it's hard for me. And what's the point? Well, that's a depressing thought. I hope that I can help you get it back into those things that you love to do and take away all of that, not all of it, but as much of that difficulty so you're not struggling as much. Isolation, that's another thing when we start to withdraw. And I think that, you know, when we can't hear, we don't want to do those things. And then when we withdraw, now we're taking that social element out of the picture. And that can also lead to more cognitive decline. I was just talking about how amazing it is that you guys have this community and you're able to stay social and able to get together and able to, you know, live such great lives with each other and kind of navigate some of these worlds like audiology and things that, you know, were never really a part of your life, you know, 10, 20 years ago. And be able to really, you know, enjoy your life, you know, through its entirety. So, relationship problems. Oh, turn down the television. I heard in the back. Frustrations with spouses and children and anyone that you're, you know, close friends. This is something that's funny to me because I sometimes I'll get, is there a mute button for my spouse on the hearing aid? And I say, I'm in the business of helping relationships, not hurting them. But yes, you know, getting frustrated with the people that you love because you have to repeat yourself multiple times, that's no fun. So, you know, the hearing aids can definitely help with, you know, that fluid communication and not having to ask people to repeat themselves so much. And then safety concerns I already kind of touched on there as well. Okay, so just to get into a little statistics here, 60% of risk factors for dementia are linked to aging and genetics. And I don't know about you, but I know for me, there's nothing I can do about my genetics. I know there's nothing I can do about the aging process. If you think otherwise, let me know. But 40% of the risk factors for dementia are modifiable, meaning we have control, we can change these different factors. Hearing loss contributes 8.1% to the modifiable risk factors. And that's at the top of the list. I think there's a list, I didn't put it up here, but there was a list of, I think, like 20 different things. But hearing loss was a huge percentage of that 41% or 40%. And so if we can, I mean, take care of our hearing loss by getting some hearing aids, that is a, you know, definitely a reduction in risk for cognitive decline or the progression of cognitive decline. So hearing aid use is associated with 1/3 lower prevalence of dementia with a moderate to severe hearing loss. So mild hearing loss is not included in this, but if you have a moderate hearing loss or even down to a severe or profound hearing loss, hearing aids can really help lower the prevalence of dementia. Without hearing aids, a mild hearing loss is a 2 times risk factor. With moderate hearing loss, it's up to a 3 times risk factor. When you get to severe hearing loss and you don't have hearing aids, that is a 5 times risk factor. So there's a lot of risk involved here, with our cognitive health. But fortunately, we have something that can help with that. It's not going to eliminate the risk altogether, but it can lower that risk factor. Any questions about any of that? I know that's a lot of information. Okay. How much do hearing aids cost? I get this sometimes right after a hearing test before I've even talked about hearing aids. It depends on the level of technology. So as what we were talking about earlier, that there's a range of costs for even the over-the-counter hearing aids, there are levels of technology. As a rule of thumb, it is more complex than this, but how I counsel people on levels of technology, it is that the higher you go in level, the better the noise reduction capabilities. So it's really dependent on lifestyle. So if you live an active life and you're in dynamic, noisy types of environments, higher levels of technology should definitely help to reduce that noise and help emphasize the speech so that you can maintain that conversation better when there's noise present, because these hearing aid companies know the hardest situations to hear in is when there's noise. I hear it all the time. Here, one-on-one, when you're speaking the way you do, I can hear you just fine. But it's when you get into a restaurant. It's when you get into a family group setting. It's when you're socializing after you go to church and there's a big group of people and you're all talking about how your week went. Those are the situations that is where it gets more difficult. Generally, for the prescriptive devices, this is kind of our ballpark. It can go from anywhere from $3,000 up to $7,000 for the pair, and that comes with varying levels of service as well. So you could just buy the hearing aids and a couple follow-ups and then pay for your services, or you can get a more comprehensive service plan where we cover all services for 1, 2, 3 years. So it just depends on, like I said, lifestyle and how you want to go about that purchase. Insurance may or may not cover some of the cost, and it's rare that they cover it entirely. I've seen it, but it's not common. It does seem that more insurances are having some kinds of benefits, which is great. But insurance don't love to pay. They like to get paid. But for those of you who have insurance that does have coverage, I mean, it's wonderful to get that kind of a break on the cost of hearing aids too. Certainly.
It occurs to me, depends on level of technology button up there. So when my mother had hearing aids,
Yes.
she complained that she couldn't distinguish that the hearing support that she had
Mm-hmm.
was complicated by hearing too much of what was around her in the restaurant or wherever she was.
Mm-hmm.
And it's almost like she couldn't filter out what she wanted to hear and eliminate all the other things that the hearing device was picking up.
Right.
So has technology come a long way?
I love your question. Here we go. Okay. Yes. So, yes, technology is moving fast. We are in a technological boom right now. Generally, people look at upgrading technology around year 5, and that's because of how fast the technology is moving. I look back, so if I'm upgrading someone's hearing aids that had hearing aids from 5 years ago, if someone comes in with 10-year-old hearing aids, I look at those and I go, I can't believe we were dispensing these hearing aids. That's how fast the technology is moving, and that's how much better it is getting. And like I said, the main priority of these companies is to help people hear better in noise. So they are integrating, they're starting to get into like using AI to analyze the sound environment and detect, is this speech? Is this noise? And then if it's speech, how do we emphasize that? If it's noise, how do we reduce it? How do we create that separation between the speech and the noise? So these chips are becoming a lot more sophisticated. So those things are increasing, are getting better just at a fast rate. And so I think that people want to hear better, and once they realize that they can with hearing aids, they're excited to get into another hearing aid that's even better when those opportunities, if they can. When those opportunities arise, it's, you know, we're never going to force you into a new upgrade, but we're going to let you know when there's something out there that can get you hearing better, that we think is going to be a noticeable difference. And so it's hard to judge what your experience is going to be based off of a parent's or based off of someone who had hearing aids 10 years ago. Even someone who got their hearing aid 1 year ago, your hearing loss might be a whole lot different than theirs. Theirs might be very complex. They might have a lot of distortion in their hearing, and the hearing aid is only going to do so much. Whereas someone with good clarity and just some hearing loss, where if we amplify for them, they get good clarity out of the hearing aid, that's a different experience. So everybody is so different from case to case. So it's really hard to judge what your experience is going to be based off of someone else that you knew that had hearing aids.
Doc, was the integration of the hearing aid world and the smartphone, was that a big game changer?
Yes, I love it. And I love that more of my patients are tech savvy at this point. But I work with the whole spectrum of I just want to put the hearing aids on and not touch them. And I want all the control. I want the app. I want the phone. I want everything there. So I can always work with you depending on what your level of familiarity with technology is. But the integration with the phone has been great, primarily because when I'm on the phone, I go like this. I have one ear on the phone. When you have hearing aids, now you get two ears on the phone. So that's a big advantage. So phone calls have become easier. And then we used to have like remote controls kind of like this, that you can like turn your hearing aids up or down, or there's buttons, but some people with dexterity problems would have a hard time hitting those buttons. With the phone, you could have an app and just turn up the volume or turn it down or change your program. So it has been a lot easier for people now that we have those kinds of advances.
You have a workshop when you fit somebody.
It's on, I can hear you.
Okay, because what you're talking about is pretty complicated stuff.
Mm-hmm.
And, you know, my husband was one of those, I want to put it in and not touch them.
Right.
But he always complained that his hearing aid wasn't doing anything, but he was not tech savvy.
Right.
You know, every time I had to tell him how to turn on a computer. So, is there workshops that teach you those sort of things so they become secondary?
That's part of my follow-up. So I don't have any designed workshops for that. However, when I do an orientation, I teach you everything you need to know about the hearing aids, and I try to keep it concise and simple. And then once if we decide that we want to use the phone with the hearing aids, then I will show you how to use the app. And I start simple. And if you want to learn more, I can help you learn more about it. But I try to keep things as simple as I can and explain it in a very clear way. And my only ask is that you're honest with me and you say, I think I can do that, or that's complex, you're losing me. And then I can say, okay, let's try to explain it in a different way. So that's where a lot of the follow-up is important with an audiologist, right? If you have an over-the-counter hearing aid and you don't have someone that's going to help explain these things to you, it can be complex. But I try to keep it simple.
So it's the app that's got the spouse mute button, right?
I plead the fifth. Okay, and then in California, we have a 45-day fitting period. It's a regulation that is in place that from the day you get your hearing aids, we have 45 days to make sure that those hearing aids are right for you and you're getting good benefit. So if for some reason at the end of that 45 days it really isn't working out, we can either do a return and refund, or we can do an exchange and try something different. For me personally, this isn't the case everywhere you go, but for me personally, I like to see my patients back 2 to 3 times during that 45 days, every 2 to 3 weeks. I want to check in with you. I want to see how things are going. If we need to address any concerns, that's our time to really work together, you and I, to make sure that, hey, you're doing well. And then if for some reason we can't get that right at the end of that time, we can either do an exchange and try a different product, or we can do a return and refund. So it's really nice to have that as a safety net. We don't have to use it very often, fortunately, now that the technology's become so much better, but it is there for us just in case. Will I hear perfectly with hearing aids? Nobody hears perfectly. I have trouble hearing sometimes too. It's not going to bring back normal hearing. So how you heard when you were 18 years old, it's not going to bring back that same. It's a hearing aid. It's not a hearing cure, right? So it aids in your hearing. It's not going to cure it or bring it back to the way that it was. So that's an expectation to set, but it should provide an improved experience with your hearing. That's what I just said. Okay, so this is a very important part of the hearing aid process. Is we hear in our brain, not in our ear. Our ear is just a vehicle that collects the sound and transmits it up to our brain. Our brain is where we perceive everything. So when, especially if you've had hearing loss for a very long time, that's the way your brain thinks is the normal way to hear. So when we put hearing aids on you for the first time, things often sound very different and strange. And some people say it's tinny, it's sharp, it's harsh. Maybe they have a little echo to their own voice. Their voice might sound loud to them at first. But the biggest key to your success with hearing aids is consistent use. So if you use those hearing aids every day, you're training your brain to say, this is how I want to hear now. Then maybe after about a week or two of good consistent use, everything should start to settle down and sound more normal and natural. So it's really all about how the brain hears. And so will you hear perfectly? No, but if you want to give yourself the best shot at doing the best you can with hearing aids, that consistency is very, very key to your success.
Includes the morning too, right?
That includes the morning as well. Yes, it does. Yep. It's really during your waking hours. Yep. Do I have to wear my hearing aids all the time? So this is kind of leading right into this here. Full-time use during your waking hours is always encouraged. It's the time for the brain to adjust to a new way of hearing. And the duration of hearing loss has an impact on the adjustment to new sound. I had a patient just the other day who's had a severe hearing loss for a long, long time and has not worn hearing aids. And it has been 3 months and we're still slowly increasing. I started him off real soft and he still wasn't hearing very well, but at least we're getting him some sound. And then, slowly we've been kind of increasing the volume and we're trying to get him to that prescription, but it's taking longer because his brain has learned that hearing loss is the way to hear, and we have to untrain that. Yeah. So sometimes it can take some time. You just have to stick with it and trust the process. What's the difference between Chivas and Costco? Okay. The provider. Some Costcos do hire audiologists, but you might also get a hearing instrument specialist that doesn't have the same level of education about hearing. The counseling that's involved. So the hearing aid is the tool. It's not better hearing on its own. Better hearing is the use of different tools to help you navigate different situations and hearing environments. So that education that comes into this and the experience of the provider that you're working with is very important to your success as well. And so it just depends on what kind of counseling you're going to get, and that's going to help, you know, determine whether or not you're using those devices in the right way. Now, so here, like I said, it's just the tool. It needs to be programmed properly, so we want to make sure. I'm not sure if Costco does the verification testing of the prescription or not. I've heard mixed things. Some okay, some they do. So that's a good start. We do scheduled follow-ups. I don't know. Do you know if they do any scheduled follow-ups, and for how long, or is it just in the beginning, or do they continue following up with you as needed? So I like to, at the very least, see you once a year, and we do a hearing test to monitor annually to make sure your hearing isn't changing, because if your hearing changes, then we need to reprogram the hearing aid. I oftentimes see patients every 6 months, and I'll do a clean and check appointment where I take the hearing aids, replace all the parts, take a listen to them, make sure they're not weak or distorted. There's oftentimes people come in and they go, yeah, the hearing aids are working fine. And then I listen to it, I'm like, this one's dead. Nothing's coming out of it. So that person wouldn't have known to go back into as an as needed appointment. So we do try to have scheduled follow-ups at Cheers at least to make sure that your hearing aids are continuing to work well. You know, it's like going to the dentist. You know, you might not have any teeth problems, but you go in and get them cleaned and make sure that they stay working good, you know, until your next visit. Okay, so the level of technology, Costco's hearing aids, oftentimes there's 6 big hearing aid manufacturers. They make prescription hearing aids, and then they also make wholesale hearing aids, which go to Costco. Their wholesale hearing aids do not have the same sophistication of the chip as what we get as an audiologist in a private practice. It is not as high of a level, therefore the noise reduction isn't quite as good as like the premium level products that we have to offer. I've been told that it's either comparable with the mid-level or it's somewhere between an entry and a mid-level. So going with a mid-level hearing aid or higher in a private practice is going to give you better noise reduction than the technology that you would get from a wholesale hearing aid at like Costco.
But you guys don't sell booze, right?
No, that's a different license. So tinnitus and hearing aids. So this is one of my favorites. I work with tinnitus. My dad worked with tinnitus. He trained under the Pavel Jasterboff, who was the godfather of tinnitus treatment, and I trained under my dad with this, and so I love working with people with tinnitus. Not very many people do because it can be challenging. Everybody is so different in their tinnitus. If you have tinnitus, if you have ringing in the ears, but tinnitus is a condition where a person perceives a sound in their ears or head even when there's no external source of sound. About 2/3 of people, just from correcting hearing loss with hearing aids, notice an improvement in their tinnitus. So that tells me that a lot of the time the tinnitus is the symptom of the hearing loss. I have people that come in and say, I can't hear because I have ringing. Well, I think it's the other way around. I think it's you have the ringing because you can't hear. Before I get into that, it's been compared to, have you heard of phantom limb syndrome before? So if you have an amputated arm, your brain is used to receiving input from that hand, say. And then when the hand is not there anymore, you might still feel the sensation or burning or tingling or numbness in that extremity because the brain is reaching out for that sense that it doesn't get anymore. Similarly, in the ear, if the brain isn't receiving the sound that it's used to receiving, now it's reaching out for sound and perceiving a sound that's not there. And so when we stimulate the brain with more sound using the hearing aid, it's not having to do as much of that work reaching out for that sound anymore, and the perception of that tinnitus can come down. And we use Widex Zen sound therapy. So in one of our hearing aids, there is a sound therapy that has research behind it out of the University of San Francisco. And they find about an 80% success rate. That's about what we find with it as well. So for the people that don't get the relief of that 2/3 of the people with the hearing aids alone, we also have a sound therapy that we can work with you and try to help to reduce the effect of that ringing in your ears. Okay, so that comes to the end of the presentation. Do you have a question? Yes, let's hand you the microphone there.
I have a question about earwax.
Oh, I like this one too.
Because my husband is, the hearing aid will be fine, it's working.
Yes.
2 days later, one side is not working.
Yep.
And he stands there cleaning out his ear and he tries to get the tip of the hearing aid and
Yep.
cleaning that off.
Uh-huh.
And it seems to be more often. And so what's going on?
So there is no hearing aid or traditional hearing aid that doesn't go into the ear canal. And in the outer 1/3 of our ear canal, that's where all the wax is produced. And unfortunately, that's where a hearing aid sits. Whether it's a custom device or an over-the-ear device, there's always a piece that goes into that area. So earwax is the enemy of a hearing aid. So some people who are overproducers of earwax, they'll go periodically to have their ears cleaned. And that can help reduce the amount of wax that could get caught in the hearing aid. But the maintenance on hearing aids is important. So I always counsel people to clean their hearing aids each night. Usually we give you some cleaning supplies, teach you how to clean them. And then if it plugs up, you can replace either the dome, the tip over the end of the speaker in the ear, or there's a little filter that you can replace. I'd say 90% of the time, if a hearing aid isn't working, it's because of that. So he's not doing anything wrong. It's just a matter of either keeping the ears clean or making sure that you keep up with the maintenance on the device itself.
Is there a certain solution that you put on it?
No, generally you want to keep it dry because it's electronics, and so you don't want to get any moisture down in there. It's really more so brushing, wiping, and replacing a part if needed.
Carol Online has a question.
Yes.
When I've had my hearing tested, it's been quite good age, but I have extreme allergies and I'm taking all the medication and sprays that I possibly can to control the allergies. But I still get a backup in my eustachian tubes and then I can't hear.
Okay.
What can I do?
So that is where the audiologist and the ear, nose, and throat doctors work together. When it is a eustachian tube dysfunction because of allergies or swelling in those areas, that's where an ear, nose, and throat doctor, you would want to talk to them to help try to either keep those open, or if it's something that's chronic that can't be fixed with any kind of procedure or medication or medical treatment, you can talk to your audiologist about either a volume control. So on the days when your allergies are bad, you could turn it up. Or having another program that's a louder setting. So in those days where the allergies are acting up, you could go to that louder setting and overcome that drop in hearing because of that. But I would work with both the hearing aid provider and the medical doctor to try to see what's the best solution there.
I was afraid you'd say that. Thank you.
But yeah, it's a team approach sometimes. So sometimes we have to get, another person involved.
Yeah, I understand. Okay, thanks.
Yeah, you're welcome. Any other questions? Yes. Oh, let's get the mic. You want me to hand it back there? Okay. Oh, there we go.
Is there a risk? Can you hear me?
No.
Oh, I can. Okay. Is there a risk of? Oh, hallelujah. If you're using OTC devices that you might be harming or increasing the real issue that's existing, and the OTC is really not helping you. Might be more issues.
So the question is, if you're using an over-the-counter device, by turning it up, Is that what you're saying more so, or is there a risk that you might be harming your hearing? My initial thought is no. And that's because hearing aids have something called a maximum power output. And so hearing aids shouldn't be able to output a level of sound that is going to be harmful for you. And especially because an over-the-counter hearing aids are generally better for a mild to moderate hearing loss, then it shouldn't be able to achieve those levels of gain where it could be harmful. Noise-induced hearing loss is a function of the level or the intensity of the sound over time. And so if you're at a rock concert that's 120 decibels loud, you could be causing instant harm to your ears. If it's 90 decibels, you might be able to stay there for 2 hours. If it's 85 decibels, you might be able to stay there for 8 hours before it causes any harm. And it's exponential. So with that intensity, every 5 decibel increase is going to shorten that time by almost half. So when you get into those louder levels, then that's where the problem's going to be. But as far as like a hearing aid and the hearing aid's output, they shouldn't be achieving those levels of amplification to harm hearing. Otherwise, I don't know if it would necessarily be passed for over-the-counter through the FDA. And I think that's probably part, I don't know for sure, but it probably is part of the reason why those are designed for that specific mild to moderate type of hearing loss. Yeah.
What about the Apple device? Do you think that they're equivalent to the over-the-counter?
That's tough. I don't know yet. I haven't seen them yet. So
That's what I recommended.
I've seen what they look like, but I mean by I haven't seen that yet is I haven't had someone bring it to me. And when over the counter first came out, there were these little devices called Eargos that you put down deep in your ear. And I did some testing on it with our verification equipment, and they did a good job for that mild to moderate hearing loss. They did a pretty good job as far as being able to output the sound. So I'd assume, and Apple's a great company. I've got the watch and the phone. And So just for the people at home, Joy said that those Apple AirPods might not fit the ear properly, and then they can fall out. So the design of a hearing aid over the ear is designed for multiple points of retention on the ear, so it can stay in even when you're being active. So yeah, it's kind of like a one size fits all, and not everybody's ear, people have smaller canals, larger canals. It's very different. So that's part of our fitting process is we pick a length of the wire, we pick the size of the dome, and we make sure that everything looks like it's going to stay on and be retained on the ear when we're choosing hearing aids for people. Tips for telephone usage. Are you talking about a landline?
I have both landline and cell.
Landline and cell? Yeah.
Again, it depends on who's on the other line.
And it depends on who's on the other line. So having trouble with both.
Saying hearing impaired, I may ask you to repeat.
That is beautiful advocacy for yourself, and that's part of better hearing. Is telling people. No, that's part of better hearing is telling people, I have trouble. Please speak slowly. I have trouble hearing. But as far as using hearing aids and use of the phone with a cell phone, if you can connect to the phone, that's a huge benefit to have, like I said, 2 ears on the phone. If not, and you don't want to have that connection, there's something we call the sweet spot.
Yes. And how do I find it?
How do you find the sweet spot? All right. So generally when we pick up a phone, we put the speaker part of the phone over our ear. Well, when you have a hearing aid that sits on top of the ear that's amplifying sound for you, you're missing that. So sometimes pulling the phone up and putting that speaker part over where the hearing aid is and moving it around till you find that spot is going to help you hear better on the phone. There are also, I have this little application packet, and it's for amplified and captioned telephones. Joy has them at the table over there, and if you're at home and you want one of these and you're zooming in today, we can get you one of these. What it does require, though, is an audiologist to sign off that you have hearing loss, but it's covered by the state, and they'll come in and hook it up for you at your home. But this is another option for landline phones, is to have an amplified phone or a caption phone that will display captions as the person's talking, so you can kind of read along with the conversation as well.
Tell them it's not in their packet because.
It's not in your packet, so if you want one on the way, Joy has them out front.
Okay,
No, not down. Well, if your hearing aid's down there, yes, but you want to hold it up top over where the hearing aid sits on the top of the ear and kind of move it around till you find where you're feeding the sound from the phone into the hearing aid.
So you think the hearing aid rather than your.
Rather than trying to put it into the ear, you want to put it into the hearing aid, whatever the sound is. Yes.
Is there a way to know whether something that you're doing is too loud?
Is there a way to know if if something that you're doing is too loud? A blow dryer. That's hard. Yes, there are apps that are sound level meters, like on a phone, that you could like record and it will tell you what the sound level is. But you'd have to know what the function is of how loud over how long, right? So you could look up what is the level, what is the level of a blow dryer, how loud is a blow dryer? And then you could kind of compare that to OSHA's guidelines of the duration of that noise exposure. If you're only blow drying your hair for 10 minutes, 15 minutes or something like that, then but for that short amount of time, it would probably have to be like 100 decibels, which I don't think that's going to be the case, but safe 80 decibels, up to 80 decibels. And then when you start going over 80, that's where, but like I said, you go from 80 to 85 and that's 8 hours. You're not blow drying your hair for 8 hours.
Your watch, if you have a smartwatch, it will tell you if you're destroying your hearing.
Yeah, there's that function on the smartwatches too.
That says that's too loud.
Yeah.
Okay, I'm going to change the subject while I've got the mic.
Certainly.
I just wanted to compliment you on your service. My husband got hearing aids from Sharp and they've been great. Our audiologist's been great. But a couple of months ago, you know how it's battery operated, so you have to take the battery out. You turn in the little thing that goes around.
Yeah.
Anyway, it got stuck. My daughter called your service and that afternoon, a tech got her in, got it fixed for $65. My husband had his hearing aids back the same day. So thank you, and we will use you again.
And thank you. Yes, we want to help. That's the end goal. That's why I do this. I want to help people.
Didn't know back before that. So I asked you.
Well, thank you. I'm glad you came in.
Probably not an answer to this, but I go to the pool.
Aha.
And I don't wear my hearing aids in the morning that day to make sure that I don't wear them into the pool.
Right.
But is there any way to protect them or to use them in the pool?
I'm going to say generally no. Generally. However, there is one company that I know of that claims they have a waterproof hearing aid. I also am not the person that's going to test that theory. Like they say that the new iPhones are waterproof. I'm not throwing my phone in a pool. Try to keep them as dry as possible. And it might just be my experience with the older hearing aids that I've seen really weird, strange things happen when hearing aids get wet. And so I always err on the side of caution. Hearing aids do have what they call an IP68 rating, which is a dust and moisture resistance. And so that's one of the highest dust and moisture resistance ratings you can get without it being actually waterproof. They call it weatherproof. So like a rain, or if you're exercising and have a sweat going, it should be okay. But I don't, not in the shower, not in the pool. I mean, I even try to keep chargers out of the bathroom because of moisture. I just err on the side of caution. I just, don't want that ever to be a reason that you can't hear, or your hearing aids are giving you problems and you're having to send them in for repairs and things like that. But it's tough because I have patients who are big time sailors and fishermen and love doing water aerobics classes. And in those situations, it's hard to hear the instructor. And I wish I had a better solution at this point, but who knows? I mean, like we said, technology is moving forward, and they already have one company that's claiming a waterproof hearing aid. So it might be on the horizon. The watches, you can swim with them. I also still get scared with doing that, even though I have showered with it and gone in like a jacuzzi with it, but it still doesn't sit right.
For several years now, and it's doing great.
It works. It works. So they have the technology available. Just I'm still waiting on something a little bit more confirmed before I can start recommending it. Yes.
Tell us your best story about somebody who could really hear in the restaurant.
Who could really hear in the restaurant? Oh, wow. Okay. Honestly, the newer technology coming out now has really impressed me. For one of the companies we work with, I just fit their newest hearing aid for the first time yesterday. And I went to a training, and we were at the Seasons 52 in La Jolla, and we had the door open to the restaurant, so all the noise was pouring in, and the person up front put noise on their cell phone in the room, and we switched the program from like the general setting to the hearing and noise program. And with normal hearing and an open fitting and being able to still hear all that noise naturally, I could tell a big difference, and that's really actually impressive. I was like pretty shocked with how well it was doing, and I've had some patients come in that let me see, there was this particular patient I just fit. He always has done fairly well with his hearing aids, but he always struggled in the restaurants and with his family, and because he has a big family and they get together a lot, very family oriented patient. And he came in for his first follow up, and I asked him just, how's it going so far? I know you haven't had it very long. And he said, I went to a restaurant and it was just like night and day better than what he had from his past set of hearing aids 5 years ago. So that just to me gives me confidence in telling you that like that kind of 5-year point that we kind of use as a rule of thumb it's a significant difference in what the technology can do, and it just lowers it down. And it's really because I sometimes will do a demo in the office where I'll put noise on my phone behind the person, and then I'll switch between the programs to show them when we elevate that noise reduction what it sounds like. And that patient, when I turned the noise on, put it down, and then I said, okay, so this is the normal setting. Here's what it's like with the noise reduction. And just to see his face go, like just that, it was the expression on his face that just said it all. So I don't have like a really grandiose explanation or example of it that I can think off the top of my head, but just the most recent one. That's the top of the line.
7,000.
But that's with all comprehensive service, that's not necessarily going to be what it is, but it can be up to that level depending on insurance, services, all of that. But yeah, those premium levels do a really good job. They do a really good job.
You stick with one company, or do you?
I was with four of the big six. So there's six big hearing aid manufacturers, and then each of those have like smaller companies that use a variation of their sound processing. But I stick with the big name companies, and then they all work with that level structure, and the pricing is the same. So I'm not biased by this one's more expensive, less expensive, this one's better. And I could probably fit 90% of my patients with any one of those companies and do a really good job. So it's the competition amongst the companies as they've improved technology has really leveled things out. 10 years ago, if you asked me, I'd say this company's better right now, but then these ones would catch up. And then this one would make an advance, and then these ones would catch up. They've all kind of leveled out pretty well. They all are using, doing the same thing. It's like a race to get the best products, which is good for us because we're getting better and better technology.
Mention the names of those four.
Yeah, so I work with Oticon. Resound is one of the big companies I work with. Phonak and Widex. The other two that I don't work with who are still good companies are Signia, which is Siemens hearing aid company, and Starkey. So those are the 6. Yes.
This may be too soon, but do you have any notion whether tariffs are going to affect hearing aid prices?
I don't know. Here's the thing is that even though the companies are based out of so half of those 3 of those 6 companies are Danish. One of them is Swiss. One of them's German, which is Signia, Siemens, and one of them is US, and that's Starkey. They all have headquarters in the US though. So that's why I don't know. Because if they have headquarters here, I think it should be okay. But I don't know.
Well, it's all about where they're manufactured.
Right. So they have manufacturers, They have manufacturers here in the US, but their companies are based abroad. So I don't know. It's a good question. I'll have to look into that.
So, Jack, what is your recommendation in the circumstances where, like, in my own personal circumstances, I can hear the cats walking around the house. I can hear a car door close down the street, but I'm having increased difficulty with ambient noise in that restaurant setting. So what is your approach when the issue is not volume, but it's strictly the ambient noise thing?
Well, I would start with a hearing test. And then we can evaluate, do you have hearing loss? Is there a water somewhere? My throat is getting dry. Dang. It's okay. I have one in my car. No, thank you. Excuse me. So what is this? Oh, no, it's okay. I would say that start with a hearing test. We would take a look and see what your hearing looks like. And then if you're a hearing aid candidate, there are features in the hearing aids that we can adjust for specific sounds like that. So like we can adjust for just noise or soft level noise or impulse noise, like a door slamming or a plate dropping. So there's like specific features in our software that we're adjusting for. So if you come in with a specific concern, we can try to isolate what that is and make the adjustment on the hearing aid to help with reducing that sound, and then not touching the other things. So it just depends, I guess. I mean, without hearing aids though, I just don't know. We'd have to start with the hearing test before and then go down the process, kind of go through the line there and kind of determine the best solution. Sorry, it's not such a direct answer though.
I have the same problem as Mark does. When we're in a restaurant, we have, Tuesday lunch group and we have this group and that group, and we always go to lunch in a restaurant.
Mm-hmm.
And I do a test every year And I'm not anything yet to do a hearing aid,
Right.
but I am having progressive more problems. Maybe that's how it starts.
So-
I don't know.
Like I said, even people with normal hearing don't hear perfectly. I have to remind myself of that all the time. I was at my I could run to my car if I need to. I think we're getting there. Had a birthday dinner 2 years ago, and we went to an Italian restaurant, and there was 13 of my best friends sitting at a table. I'm sitting kind of towards the end. I could probably hear the 5 people near me, but nobody at the end, anyone past that. I couldn't. And my friend who was down about 4 seats down on this side tried to talk to me, and he was like leaning in, and I was looking at him, and I said, hold on, and I moved around and I went and sat by him. I have normal hearing. That's hard sometimes. Some of those restaurants are really challenging, and it happens to me when I'm at home and I have someone in the living room watching TV and I'm washing dishes and they say something to me and I didn't hear them. Hold on, let me turn the sink off. Let me walk in there. Hey, sorry, the sink was on. I didn't hear you. What was that you said? So, but I have an idea of why. You know, a lot of people don't think about the why didn't I hear that, especially with hearing aids. They think my hearing aid's not working. I can't hear that. But it might have been a situation that even someone with normal hearing would have had trouble with. So noise is tough. Hearing aids are really, if you are a hearing aid candidate, they're going to help you, but it's not going to be perfect because it never is perfect, even for people with normal hearing. So it's just the biggest thing I think is the visual cues. We were talking about it earlier. With COVID, it was tough. The masks took away the visual cue for everybody. So being able to see someone's face when you're talking to them, it really can add like 20% extra clarity. So if you're not looking at the people you're talking to in those complex situations, you're gonna be having an even harder time. So it's a combination of hearing aids, a combination of communication strategies, and there are accessories, amplified phones, TV ears. There's a lot of different things that can help us hear better. And so better hearing is not just one of those. It's using a lot of those strategies. Advocacy, huge, helping people to understand that, because hearing loss isn't something that puts you in a wheelchair or puts you on a walker or, puts you in a cast. You can't see it. It's something that you're dealing with that no one knows that you have that. And so you have to advocate sometimes in those hard situations to help people understand that you might have trouble with that situation with your hearing. So.
Let's just stop talking.
Okay.
First of all, I want to say, I've been communicating with him for like 5 months now.
Yeah.
And every little thing I mentioned to him that we might be interested in, every little thing, he must have researched and done and added it to his speech. So I really appreciate that. It was really an impressive presentation.
Thank
So,
you.
yeah, thank you.
Thank you for having me. Thank you so much.
And
then, sorry, one more thing, if I might mention, in your folders, there is a little certificate for like a hearing test, and that's complimentary. So if you do want to come in for a hearing test, call us, and when you call in, let our front office know that you came to this talk and that you wanted to use that certificate. And so that's complimentary to you to come in and get your hearing checked with us. Yes.
Is it better to go in and have your ears, if you don't know if you have wax buildup?
Right.
Is it better to go in and try to have all that before you have a hearing test?
Yeah, because if you came in and it was something that we wouldn't be able to take out, sometimes we can, just depending on what it is. If it's not something we could do, then you'd have to go get that done and then come back. So if you do that ahead of time, then we don't even have to worry about it. We always look in the ear before we do a hearing test. Yeah. Yeah.
thank you again.
Yeah, you're welcome.
Very enjoyable. I learned a lot.
Thank you.
Thank you.